Hello, welcome. I hope everyone is having a great day so far. Okay, I'll go ahead and get started. So, welcome to today's webinar, Bouncing Back, the pandemic's impact on students with disabilities and how to advocate for them, hosted by the Educating All Learners Alliance, or ELA for short, and the Center for Learner Equity. My name is Whitley Patterson from the Educating All Learners Alliance, and I'll be your host. Before we dive into today's content, I'll share some information about ELA. We are a coalition of organizations dedicated to producing and sharing resources, programs, and events, like these dedicated to supporting students with learning differences. With us today are Laura Stellentano and Cache Owens from the Center for Learner Equity. I'll pass it over to Laura from the Center for Learner Equity to start today's presentation.
Hey, thank you, Whitley, and thanks everybody for joining us today. So my name's Laura Stellentano. I'm the research manager at the Center for Learner Equity. So I'll be kind of presenting today from my lens as a researcher, looking at some of these issues, and I'll let my colleague introduce themselves.
Hello, everyone. Good evening, or I guess good afternoon, depending on where you're calling in from. My name is Cache Owens. I use they, them pronouns, and I am also at CLE along with Laura as the Senior Director of Communications and Marketing. And I am just here to give a bit of a parent perspective. I have a 13-year-old son with autism and severe mental health challenges who has been, on his educational journey throughout the pandemic, as well as somebody with disabilities myself, and just sort of sharing some of the stories that CLE has gathered along the way, reflections from students with disabilities during their time in the pandemic. So excited to be here with you all today.
Yeah, so in today's session, our plan is to provide you with an overview of the evidence that we've gathered on how the pandemic has affected students with disabilities. And then we want to make space to connect that evidence to media reporting and also personal experiences and stories of the pandemic's impact for students with disabilities. We want to leave a good bit of time to engage in discussion around the ways that educators can best advocate for their students with disabilities and their families moving forward. So we want to do a quick poll just to get a sense of who has joined today and what your role is. So we will, you'll see a poll pop up in just a moment. Go ahead and select which reflects your current role the best right now. There we go. So we have just a handful of educators, district staff person, but mostly some nonprofit organizations similar to the Center for Learner Equity. I know that's what we would have selected, and some others. Are there any others sharing where they're coming from in the chat?
It looks like we have some parents, which is really exciting. And I'm just so grateful that we have parents in the room. So that's great to see.
That's awesome. We will really look forward to making some space for having discussion and hearing about your experiences. Awesome. Thanks, everybody, for participating. So moving along, and just a bit of background on what we did at the Center for Learner Equity is we, as part of a series of papers that was compiled by the Center on Reinventing Public Education, they've been putting together papers to synthesize the best evidence available on the pandemic's effect on U.S. students. And so the Center for Learner Equity has focused on doing that paper for students with disabilities. This is actually the second year we've done it. We did it last year too. And so to do that, in the most recent year, we've reviewed any new research evidence published after the summer of 2021. And so really isolating the past year to understand what we learned, we looked at a really wide variety of sources. We looked at peer-reviewed journal articles. We looked at reports coming out of nonprofits and research organizations, and also advocacy organizations, surveys that they've conducted. We looked at legal cases and summaries of legal cases. And we looked at media reporting. So taking all of these things together. And then we also convened a panel of research experts and school leaders to really vet these findings and understand what we were missing. So this is what we'll share with you today. So we'll present what we found in two parts. The first part is how the pandemic affected the outcomes of students with disabilities. So maybe unsurprisingly, but disappointingly, there's still a lot that we don't know about how the pandemic has affected outcomes for students with disabilities. When we think about outcomes and how they can be measured, we looked for evidence of the pandemic's impact on academic outcomes, behavioral outcomes, or social emotional outcomes, and even post-school outcomes like graduation. When it came to academics, we found about 24 rigorous studies of the pandemic's impact on students, but only 7 of those disaggregated outcomes for students with disabilities. So just less than a third. Behavioral and social emotional, we didn't find much evidence that spoke specifically to students with disabilities, although we found a research study out of Atlanta that suggested that discipline disparities for students with disabilities that were already poor before the pandemic may have gotten worse. And post-school outcomes, we, again, don't have a lot of information yet about how students with disabilities did, although there was some evidence that showed that graduation rates may have temporarily increased when a lot was shut down. But a big theme of what we did find is that when research looks at students with disabilities, it tends to frame students with disabilities as one monolithic group. But this masks really critical variation in students' experiences and their outcomes. Some students with disabilities are also learning English. Students with disabilities have different racial and ethnic backgrounds, and they come from different socioeconomic statuses. There's so many different aspects to student identities that really aren't reflected in a lot of the evidence that we found. And we know that these things really shaped people's experiences during the pandemic. So some of the strongest evidence of the pandemic's impact come from the NAEP assessment and the long-term trend assessment. And what this shows us is that students with disabilities scores before the pandemic started well below their peers in both reading and math, but that scores declined on a steeper level than all students in general. So this data is just from 4th grade students, but it certainly raises concerns, but also isn't surprising given all that we know. So altogether, an important caveat to share as we think about what we know about the pandemic's impact, and particularly the academic impact, is that nearly all the research studies that we looked at only show evidence of the pandemic's impact on 3rd through 8th grade students. And they're all focusing on standardized math and reading assessments, which is really just one narrow way to measure learning. So just want to kind of caveat this with what we know, but also all that we still don't know really about how the pandemic has impacted learning and other outcomes for students with disabilities. And I want to pass it along to Cache to add more kind of personal context to this data.
Thanks, Laura. So I'm really excited to just get to share and reflect a bit about my family's own personal experience, but with the caveat that, of course, we're just one family out of millions who were trying to hobble along some form of learning for their students during the pandemic. But I think just hearing some personal stories sort of grounds the data and the research in the lived experience and humanizes it a bit. And so a few reflections just to start with, and just a bit of background. My son Jonah is 13, as I mentioned, and has had a really sort of interesting educational background. He has had an IEP since he was in kindergarten, and is now in seventh grade and has been to I think it's 9 schools. So he was moved around a lot for different placements, trying to find the right setting for him. Had a lot of behavioral challenges, was suspended, in kindergarten, I think like 70 times. So we've been through the ringer when it comes to educational experiences. But what was really interesting for us during the pandemic was Jonah was in 5th grade in North Carolina and then moved to 6th grade in the state of Maine. And so what we were able to see is really just 2 vastly different approaches to learning during the pandemic. In North Carolina, we had a much more hands-off, self-directed approach, and a lot of asynchronous learning where we would just log on when we were able to. And then moving to Maine, we had a lot more hands-on learning time where teachers were coming to the house, where he was logging into a live class. And so we saw 2 vastly different experiences just in our own family. And so I think what that really speaks to, that I think the report also highlights, is that everybody had a little bit of a different experience with the pandemic. And so it's really hard to universalize. It's important to remember that there isn't one monolithic experience, and especially the way that the pandemic was politicized. I think that it's just really important when we're looking at data, when we're listening to stories, that we drill down and disaggregate data as much as possible, because just in our own experience, we had vastly different experiences depending on where we lived. I think the common thread was that he was miserable in both settings, but there were pros and cons to both. And so just an emphasis that it's really hard to sort of tell this story in one way, because there's so many nuances. One of the things that we did see in our household during the pandemic was this shift towards really seeking out learning in all of the different ways that it comes, which was something that, at least for us, I don't think we had fully appreciated before the pandemic sort of shook everything up. And so my son was somebody who, didn't know how to tie his shoes, didn't know a lot of basic life skills, not for lack of trying, but just was really struggling to get some of these life skills down. And all of a sudden we found ourselves at home, and we were able to really hone in on some of those life skills. He was able to do much more self-directed learning. He was able to be a little bit more active in our local community. And so what we saw was him become a bit more of a well-rounded person during the pandemic, when we were starting to make space and hold space for all of the different ways that learning comes. And so I think that there is, obviously a tremendous amount of grief that has come from the pandemic, a tremendous amount of disruption and loss, but there's also some silver linings some learnings that I think we can pull from it. And that was definitely one in our household, especially when we're talking about students with disabilities. It can be really hard, especially if you're not in a truly inclusive setting, for there to be time to be carved out to make sure that you're having this richness of experiences and learning in a lot of different environments. And so that was a bonus for us. And I think another reflection that I'll just end with before we move to sort of the additional findings from the study was really reflecting on the intersectionality and how that influenced how we lived through the pandemic. My family is a family of color. My son is Black, and to be a Black boy with a disability, as the research shows, can be a really complex experience. And so what I think that we saw was he was having much higher degree of psychological safety while he was learning. Right now, we live in the state of Maine, which is a very white state. He's in a very white school. And so to see him sort of balance the stresses of virtual learning while also feeling a bit more safe and relaxed in his home, as opposed to, feeling the daily stressors of being a Black boy in a white environment. I think there was definitely trade-offs in our household, and that is an experience that maybe not everybody is going to have. But I think when you use that intersectional lens, you can start to tease out some of these nuances. And so I think we were constantly asking ourselves, this is a really challenging time, but what are some learnings that we can take from it? And these were just sort of a few of the things that immediately come to mind, is just remembering how important local context is and taking some of the positives from it that we could. So I'll pass it back over to Laura to dive into more aspects of the report.
Thanks, Keshe. And I think that's a good pivot. We actually want to open it up for some discussion right now. We'll actually have two more opportunities for discussion as we move along, but we just want to ask you all, how does this resonate with your experience, either personally as a parent or caregiver, or professionally in your work? Are there any specific stories that come to mind that you feel inclined to share? And then we're also curious, what should educators take from these stories moving forward? The emphasis that we see a lot in the media is really accelerating learning and making up for all that's lost. And given all the many different experiences that were had, how can educators kind of make space for all of these stories and use these to inform the way that they move forward in a way that's going to be best for their students? Another part of our report focused on how the pandemic affected the experiences of students with disabilities. So, like I already said, there was a lot that is still unknown when it comes to outcomes that can be measured, like academic outcomes, behavioral outcomes. But there was a lot shared about students' experiences. And I think there's a lot of different lenses that we want to look at these experiences from to really get a more holistic sense of all the different issues affecting students with disabilities, their families, and their teachers. So one of the first things that we found was just a lot written about how with the return to in-person learning, it wasn't necessarily that instruction and learning opportunities immediately returned to normal. Inequities continued for students with disabilities, particularly students who had medical conditions or more severe disabilities, whose families felt that they faced a difficult trade-off between returning to in-person, where services may be more aligned to their child's needs, but also the safety risks of being in person, particularly where mask mandates were banned or where there was guidance that went against health guidance. So what we found in some survey reporting is that families of students with disabilities were more likely to seek alternatives to traditional schooling during the pandemic, perhaps because of some of these challenges. Another theme when we think about, I missed a slide. There we go. Mental health was a huge theme that we saw again and again. There was a small study that actually highlighted students with disabilities perspectives done by the Center on Reinventing Public Education, where students with disabilities talked about their experiences with remote learning and shared feeling isolation, stress, anxiousness, and lack of engagement, particularly when things were heavily shut down. But we also know for all students in general that students experienced hardships like death of a family member, loss of employment in the family, illness themselves, and just so many missed opportunities for socialization. As I said, we talked to school leaders, to understand how our findings showed up in their contexts. And school leaders talked about seeing signs of depression much younger in their students and a much greater prevalence than they were used to before the pandemic. And then another issue is identifying students with disabilities and finding students eligible for special education. So when we look at how eligibility rates have changed from across the pandemic, the big change that we see is students ages birth through 2, and that the rate of students with disabilities in that category declined by 15% from 2019 to 2021. So likely due to missed pediatric appointments, people staying home. But we also know that schools are going to face some additional challenges. They'll have new concerns about eligibility from COVID-19 complications that students are facing. And schools will need to figure out how to discern the effects of the pandemic from disabilities when making eligibility decisions. So the issue of eligibility has been complicated. And we certainly saw this show up in media reporting. A lot of stories of the pandemic's impact, and particularly on families and on the household, when routines have been changed, services have been missed, and socialization just isn't the same. And so we see that show up, but we want to turn again to kind of focus on the more personal stories. So I'll pass it over to Cache.
So I think one thing to remember in all of this is that we didn't completely put a pause on things, right? There was still learning happening. Schools were still open, even if virtually in a lot of places. And so school milestones were still occurring during a time with a lot of uncertainty, especially in our household. So Jonah is somebody who has been in a self-contained, behavioral-focused, autism-focused classroom for most of his educational career, and now suddenly, in 6th grade, was returning to in-person and also transitioning to the general education setting for the full day for the first time ever. And so having that huge transition that would already be a really big deal in, quote unquote normal circumstances, having that transition while also returning to the school building for the first time in 2 years, just really made that transition even more complex and I think really challenging for Jonah. So he was learning how to sort of function and behave in the general education setting while also, just getting used to being around people again. I know I was struggling to get used to being around people again and how to socialize, let alone trying to do all of that, in the peak of middle school. And so I think that there's so many milestones that occur over one's educational career that can be really stressful, that can be really intimidating, that can be really intense. But to sort of add the layer of the pandemic on top of that, I don't know that we fully have an appreciation for the burden that some of our students were carrying who are making some of these transitions, especially for students with disabilities. And I think what was really interesting, and Laura mentioned that there was such a huge focus on mental health in a lot of these studies. I think that we are, seeing policy changes being made to address mental health in the country, which is always going to be a good thing to work to destigmatize mental health and to provide more resources for it. But I think what is maybe perhaps a little bit new is the sort of universal conversations that are happening around mental health. I think there's maybe more awareness around these challenges than ever before. And as a parent to a child who's been, severely depressed and anxious and lives with ADHD since he's, was young, that was a big change for us because we weren't used to hearing this so widely talked about. And I think that there's both pros and cons to that we really have to sit with. I think there's more awareness, more understanding than ever before, which of course is always going to be a good thing. But I think what we always have to remember is just because something is common doesn't make it less serious, doesn't make it less worrisome, doesn't mean that you no longer need accommodations because, everybody's depressed. So that means nobody's depressed, right? We still have to remember that just because incidences are increasing, that it's still something to be taken seriously. And so I think we're just sort of wading through this new time where there's a renewed emphasis on mental health that I personally haven't seen before. And I think just getting used to that new normal is just something that I've been reflecting on and sitting with as a parent to a child who really needs a lot of support in that space. I think Laura also mentioned that return to normal and sort of the desire and the nostalgia that we all were living with for sort of pre-pandemic times. But for some parents who found, the sweet spot of how to support their kid in the pandemic, and to suddenly be asked to give that up, maybe was a little bit jarring, or needed more of a transition or more supports to transition from things that maybe were working in some areas and then suddenly having to give that up. And so trying to find that balance of not throwing the baby out with the bathwater, right? And keeping some of the things that worked. I know for us, we had, virtual school started a bit later than our regular school day now. And so Jonah would have time to do some mindfulness time with himself. He would have time to do a little bit of yoga in the morning. And that was really clearing his brain and creating space for learning. But now sort of back to our regular school schedule, there's less time to fit in some of those extras, right? And so how could we maybe pause and reflect on what the pandemic taught us and keep some of the things that were working and use them as complements to historical things that we've always done? I think there's some desire to have some of those conversations, but to my last point, we're all really burnt out and less resilient maybe than ever before. And so trying to find ways to be creative and innovative right now, I think just feels really hard universally. If you are not burnt out, I will buy what you're selling because I feel like just about everybody is feeling the weight of sort of starting to slowly come out of the pandemic, even though, COVID is not going anywhere anytime soon. But I think we really have to grapple with how that low resilience and low tolerance is playing out in our day to day. I know we have teachers who are managing incredibly heavy workloads, who are dealing with burnout. And when we're talking about kids with complex needs, like students with disabilities, that is work that really requires huge amounts of patience, huge amounts of resilience. And so what does that mean for our workforce and for our students? Those are just questions that I've been sitting with as a parent, and seeing, my son, who is probably always likely to have some sort of behavior challenge, and how he is sort of quicker to lose his cool, how his teachers are sort of quicker to lose their cool. It's just becoming, I think, a really complex situation when we're not making time to rest and sort of recover. And so those are just some of the additional things that we're thinking about as a family, where we're really always thinking about mental health. And we have, a lot of changes happening in middle school as he's getting ready to, go to 8th grade next year. These are just things that I'm sitting with and that I'm thinking about a lot, and wondering if others are thinking about a lot. So we have another pause for discussion, a few questions to reflect on. If these mental health concerns are resonating with you, if you're seeing these in your environments, in your local communities, and if you know of any innovative ways or things that you've heard about that can help support students' mental health needs and just general wellness, happy to hear those reflections now. And I'll also just add that there was a really great comment in the chat about working as a teacher and remembering daily that they must teach each step and not assume what kids know. And that maybe in the past it was a safe assumption to generalize about what maybe a 3rd grader would come in knowing. And now there's so much uncertainty around that. So just wanted to call out, I thought that was a really great comment in the chat. And it sounds like some folks have heard similar concerns and needs from parents.
Awesome. Thank you. So a few more themes that we want to highlight about students with disabilities experiences. And this group of themes touches on some issues schools were facing as well. The pandemic heightened the need for compensatory services. By compensatory services, we mean educational services above and beyond those that are normally due to a student, resulting from a school's failure or inability to provide appropriate services. So the pandemic changed the equation here a bit. Normally, compensatory services are coming from failure to provide these services, but a lot of schools during the pandemic, from no fault of their own, were unable to provide services, but they still owe students compensatory services. So here are some bulleted examples of the reasons why a student might qualify or need compensatory services: if their initial evaluation or IEP development were delayed, if they missed out on meaningful services to facilitate transition, if some or all of the IEP couldn't be implemented during the pandemic, just to name a few. So I'm sure those sound like pretty common challenges. As you can imagine, states and districts often misinterpreted federal guidance around compensatory services. There were some challenges, particularly early on. One important factor was that decisions about compensatory services need to be made on an individual basis. So a state or a district deciding that all students with disabilities or all students in general are going to get 2 hours of extra tutoring per week does not qualify as compensatory services, because that's not an individual decision. And then the second part of that is that the reason that services were impacted doesn't matter. It doesn't matter if it's the fault of the district or just an unavoidable challenge with the pandemic. Students are still owed compensatory services. So as you can imagine, states and districts interpreted that guidance in really different ways. We saw just approximately in the middle of the summer, about 45 different lawsuits that were happening around compensatory services. And we want to keep in mind that that likely represents just a very small tip of the iceberg for something to be raised to that level. But altogether, we really don't know how many families are still waiting for compensatory services. The Council of Parent Attorneys and Advocates did a survey of parents of children with disabilities. They found that the large majority, about 86%, said that their child experienced learning loss or regression during the pandemic, which would qualify them for compensatory services, but only about a quarter of them received any information on compensatory services, and less than that were awarded compensatory services. So a related issue when we think about schools needing to provide more compensatory services for their students is who's providing those services. We've seen a ton in the media about teacher shortages related to the pandemic. What we really tried to look at in our analysis was what we can know about specifically how the pandemic has impacted these issues. Is there any data that we can look at and compare from before the pandemic to during the pandemic? And there's unfortunately not a lot of good national data that does that. But what we do know is that special ed is persistently one of the most difficult hiring areas to fill. That's certainly not new to the pandemic. That trend has been present for a long time. But one of the things that we found when we did look for pre-pandemic to pandemic trends is a potential increased reliance on underqualified special education teachers. So this data was available in Pennsylvania, and we saw that the number of emergency certified special education teachers nearly doubled just from that time period to 2018 to 2020. A lot has changed since 2020. But we know that the reliance on underqualified special education teachers really varies greatly by state. There was a working paper done estimating reliance on underqualified teachers in different states. And this blue box here just shows some of the variability. This is the rate of underqualified hires per 10,000 students. So things look really different if you're in Pennsylvania, where that rate's relatively low compared to New Hampshire. And just to kind of put it all together, staffing vacancies and reliance on underqualified teachers may make it hard for schools to provide those compensatory services or extend and offer more learning opportunities for students with disabilities. We looked at at research on how districts were spending ESSER funding to support students with disabilities, and the most common strategy was extending instructional time. But how do schools do that when they don't have the staff for normal instructional time? In some national surveys, we saw that 90% of districts said that they had to shift their operations because of teaching vacancies. So I think this just gives a little bit of a sense that schools are certainly trying to implement more strategies to give students extra support, but it may be challenging to do that with a lack of staff or with a lack of qualified staff. So we see these issues are certainly not surprising if you've been watching the news or tuned into reporting at all. And I will pass it over once again to Cachet.
Yeah, so just to sort of connect the stories with this issue of teacher vacancies, I think one of the things that we know about all students is the importance of those authentic relationships with teachers, to have a trusted adult in the building that they can go to with concerns. And of course, those take time to build. And so what we're seeing with my son is that he really needs to have a trusted adult because anybody else, he really finds it difficult to communicate with. And so that can become really challenging when, for example, every year he has a new special education case manager, or every year the one-on-one aid assigned to a student is changing. And so this is something that's important for all students, but when we're thinking about students with disabilities and the complexity of needs that can exist, having those sort of consistent teacher relationships is so important. And so, but when we're seeing such huge amounts of people leaving the field, that can sort of become a revolving door, or maybe there's just nobody there to begin with, as Laura mentioned. And so I think that's a challenge that we're continuing to see, not just, in our household, but across the country. It can become really challenging to build those deep relationships that can be so helpful and make the difference from small success, medium success, and large success. We've talked a bit about learning loss and sort of the pressure to catch up, and the pressure that we all feel to meet these certain standards in a certain timeline. And we're sort of in this environment of really trying to shape our kids to be where we think they should be, as opposed to adjusting to where they're at and meeting them where we're at. And I think just that pressure, that continual pressure that students feel, that families feel to catch up and miss that learning loss is so intense. And it's especially intense when you don't have a really qualified teacher sort of supporting your child in the building. And not only does it make the situation more difficult, but it can also contribute to active harm. And so what we're seeing, in our family, my son, as I mentioned, has autism, and seeing that there's just a really deep understanding of what misunderstanding of what that means. There's, clearly in many environments, in many cases, conflict that my son is having with teachers that could easily be avoided if they truly understood how autism can manifest and what it can sometimes mean, and the deep variability that it exists within the autism spectrum. And so we're just seeing that it's, you sort of have to ask yourself, is it better to have a vacancy, or is it better to have somebody there who's underqualified and who could actively do harm? And it's not an answer that I have, but I just think it's a question that we have to be asking. And while all of these things are uncertain and happening, time is still ticking away. And as a parent with a disability, as a parent to a child with a disability, we know that students only have so many years to learn some of these things, right? And so as learning continues to, seemingly fall behind, time still feels like it's running out. Fortunately for us, we still have a few more years before he's out of the school system, but especially for those parents whose kids maybe have really complex needs or really severe needs, that feeling of these services are eventually going to go away when that student graduates. We still have XYZ amount to make sure that they're leaving this building with, XYZ of knowledge that we want them to have before they graduate, and time is still ticking. And so I just think there's an immense amount of stress and pressure and a sense of urgency that is building up at so many layers. And we just talked about burnout and resilience. And so I just, not anything new, but can't underscore enough how much stress I think our educators are under, how much stress some of our students are under, and just the sort of perfect storm, perfect recipe that's happening with teacher vacancies, with, funding shortages. The list can go on and on. And so I just think the situation feels very urgent, but also incredibly challenging to disentangle. So I think we have one more just opportunity to share any stories or experiences that you're seeing. What have we maybe not talked about today that you've experienced or seen or heard? Just want to open it up because, Laura and I have spent some time thinking about this, but we're definitely not the only experts in the room. So feel free to share any reflections. And then I'll pass it back to Laura to help us wrap up. So any thoughts, feel free to share in the chat or raise your hand.
All right. We're super appreciative of everyone taking the time to join and here with us today. A couple just kind of closing reflections that have been top of our mind to bring this all together is that the evidence that we've found from just reviewing the research of the pandemic's impact on students with disabilities is far from universal, and it certainly doesn't capture every student's experience. So for educators, just the importance of getting to know your individual students and their experiences during the pandemic and their unique needs is really critical. And also that the research evidence doesn't always match the urgency of families and students' experiences. So it's important to stay connected to your students and their families so that you can have a better sense of those things and how they're affecting kids in real time.
Thank you, everyone, for joining us and for letting us share this report with you and some of our personal experiences. So just appreciative for everyone attending.
Thank you. That was amazing. On behalf of ELA and the Center for Learner Equity, thank you for joining us today for Bouncing Back: The Pandemic's Impact on Students with Disabilities and How to Advocate for Them. You can check out our website at educatingalllearners.org and follow us on Twitter at educateall_.org. Also, be sure to check out the Center for Learner Equity at their website, thecenterforlearnerequity.org, and follow them at Learner Equity. Keep an eye out on an email with links and other information that was shared today. And thank you. Everyone have a great day.